Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Fatima here, and today I'm going to explain the gross anatomy of male and female urethra. So first of all is male urethra. Male urethra is a muscular tube that conveys urine from the internal urethral orifice to the external urethral orifice. The internal urethral orifice is located in the neck of the urinary bladder, while the external orifice is located at the tip of the glans penis in males. Male urethra also provides an exit for semen. For the descriptive purpose, male urethra is subdivided into 4 parts. The first one is the intramural part, which is also known as pre-prostatic urethra. The second one is prostatic urethra. Third is intermediate part of urethra. This intermediate part of urethra, it is also known as membranous part. And the fourth one is the spongy urethra. Or we can study male urethra in another way by dividing male urethra into 2 parts, anterior urethra and posterior urethra. Anterior urethra is 16 cm long and it constitutes bulbar urethra and penile urethra. Anterior urethra is basically the spongiest part, which is surrounded by the bulbospongiosus muscle. Bulbourethral gland also open in this section. Then the posterior urethra is only 4 cm long and it constitutes 3 segments: pre-prostatic segment, prostatic segment and the membranous segment. First of all, I will explain intramural part or the pre-prostatic urethra. It extends from the neck of the urinary bladder and is surrounded by the internal urethral sphincter. So the length and the diameter depends upon whether the bladder is filling or emptying. Suppose if the bladder is filling, bladder neck will be tonically contracted and internal urethral orifice will be small and it will be located at a higher level. And if the bladder is emptying, the orifice will be wide, relaxed and it will be located at a relatively lower level. Now comes the prostatic part of male urethra. It is named so because it tunnels through the substance of prostate. The most prominent feature of prostatic urethra is urethral crest. Throughout the length of the prostatic urethra, along its posterior wall, there is a midline ridge which is known as urethral crest. On each side of this urethral crest, there are shallow depressions. These depressions are known as prostatic sinuses. Prostatic ducts open into the floor of these prostatic sinuses, which are almost 15 to 20 in number. In about middle of this urethral crest, there is a rounded elevation which is known as seminal colliculus, or it is also called verumontanum. This seminal colliculus has a slit-like orifice that opens into a small cul-de-sac which is known as prostatic utricle. So prostatic utricle is basically a vestigial remnant of the embryonic uterovaginal canal. 2 ejaculatory ducts, they open into the prostatic part of urethra via slit-like openings which are located adjacent to this prostatic utricle. This is the point where the urinary and the reproductive tracts merge. The lowermost part of the prostatic urethra is fixed by the puboprostatic ligament and therefore it is immobile. So in this diagram you can clearly see that along the posterior wall of the prostatic urethra throughout its whole extent there is a midline ridge which is known as urethral crest, and on each side of this crest there are hollow depressions. These depressions are known as prostatic sinuses where the prostatic ducts open. And in about middle of the urethral crest there is a prominent elevation, a rounded elevation which is known as seminal colliculus or the velomontanum, and it has a slit-like opening which is known as prostatic utricle, and adjacent to this prostatic utricle you can see that there is opening of ejaculatory ducts. Now I will explain the intermediate part of the urethra which is also known as membranous urethra. Membranous urethra, it begins at the apex of the prostate and it is surrounded by the external urethral sphincter. It then penetrates the perineal membrane and enters the bulb of penis. Posterolateral to the membranous part of the urethra, there are small bulbourethral glands and their ducts open into the proximal part of the spongy urethra. In this diagram, you can see the membranous part of the urethra as well as the location of the bulbourethral glands, that is posterolateral to the membranous urethra. But their ducts opens into the proximal part of the spongy urethra. Spongy urethra. It begins at the distal end of the membranous urethra below the perineal membrane and ends at the male external urethral orifice. The lumen of the spongy urethra is expanded into the bulb of the penis and it forms intrabulbar fossa, and the lumen of the spongy urethra in the glans penis is expanded to form the navicular fossa. As I have already told you that the ducts of the bulbourethral glands, they open into the proximal part of this spongy urethra, plus there are some mucus secreting urethral glands. They also open into the spongy urethra. Now I will explain the arterial supply of the male urethra. The proximal male urethra is supplied by the prostatic branches of inferior vesical artery and the middle rectal artery. Here I want to make one thing clear, that if I say the proximal male urethra, it means that intramural as well as the prostatic part of urethra. So proximal male urethra is supplied by the prostatic branches of inferior vesical artery and the middle rectal artery. You all know that these are the branches from the anterior division of internal iliac artery. While the distal part of the male urethra, it constitutes membranous, and the spongy urethra, it is supplied by the dorsal artery of penis. Venous drainage of the proximal urethra is into the internal iliac vein through the prostatic and the vesical venous plexus. And the venous drainage of the distal urethra is through the dorsal vein of penis and internal pudendal vein. The venous drainage goes to the prostatic venous plexus and then into the internal iliac vein. Now comes the innervation of the male urethra. The nerves are derived from the prostatic plexus, which arises from inferior hypogastric plexus. Sympathetic nerve supply is from the lumbar spinal cord segments via the lumbar splanchnic nerves, and the parasympathetic nerve supply is from the sacral spinal segments via the pelvic splanchnic nerves. The visceral afferent fibers, they follow the parasympathetic fibers retrogradely to the sacral spinal sensory ganglia. The dorsal nerve of penis is a branch of pudendal nerve. It provides somatic innervation of the spongy part of urethra. Lymphatics. The lymph vessels from the intermediate urethra, they drain mainly into the internal iliac lymph nodes, and the lymph vessels from the spongy urethra, they pass to the deep inguinal lymph nodes. Now I will explain the female urethra. Female urethra is approximately 4 cm long and 6 mm in diameter. It passes anteroinferiorly from the internal urethral orifice of the urinary bladder to the external urethral orifice, which is located in the vestibule of vagina. Here you have to remember one thing, that the musculature which surrounds the internal urethral orifice of the female bladder, it is not organized into an internal sphincter. When the female urethra passes with vagina through the pelvic diaphragm, external urethral sphincter and the perineal membrane. Here the urethral glands are present in the superior part of urethra. Paraurethral glands, they have a common paraurethral duct which opens near the external urethral orifice. Blood supply of female urethra. It is by the internal pudendal artery, superior vesicle and the vaginal artery. You all know that these are the branches from the internal iliac artery. The veins will follow the arteries and will be having the same names. Ultimately, venous blood goes into the internal iliac vein through the vesical venous plexus. Now the innervation of the female urethra. The nerves to the urethra arise from the vesical plexus and the pudendal nerve. The parasympathetic preganglionic fibers, they arise from the second, third and the fourth sacral segments of the spinal cord. These fibers run through the pelvic splanchnic nerves and they will synapse in the vesical venous plexus. From here, the postganglionic fibers will reach the smooth muscles. The somatic fibers from S2, S3 and S4 segments, they will reach the striated muscles through the pelvic splanchnic nerve. And the sensory fibers in the pelvic splanchnic nerves, they reach the S2, S3 and S4 spinal segments. Postganglionic sympathetic fibers, they will arise from the plexus around the vaginal arteries. Now I will explain some important clinicals related to the urethra. So first of all is urethral catheterization. If there is a person who is unable to micturate, or we want to obtain the uncontaminated sample of urine, or if we want to irrigate the urinary bladder of a person, then we perform urethral catheterization. The person who is performing the urethral catheterization, he should keep in mind the normal curves of the male urethra. Just proximal to the perineal membrane, the spongy urethra, it is well protected by the erectile tissue. However, a short segment of the membranous urethra is unprotected, and this part of the urethra is thin. So here the membranous part of the urethra, it is vulnerable to the rupture. Rupture of the urethra. The urethra is commonly ruptured beneath the pubis by a fall astride a sharp object. This causes extravasation of urine. The most common site of the rupture is within the bulb of the penis, just below the perineal membrane. Here the urine extravasates into the superficial perineal pouch, and then it will pass over the scrotum beneath the membranous layer of the superficial fascia. But if there is a rupture of the membranous part of the urethra, then the urine escapes into the deep perineal pouch and can extravasate upward around the prostate and the urinary bladder, or downward into the superficial perineal pouch. Urethral stricture. Any infection of the urethra is known as urethritis. So, as a result of urethritis or any trauma or injury to the male penis, it results in the formation of urethral stricture. We use urethral sounds to dilate the constricted urethra. The spongy urethra, it has a capability to expand 8 millimeters, so it allows the passage of the urethral sound of this size. And the external urethral orifice, it is the narrowest and the least distensible part of the urethra. Hence, an instrument that passes through this part of the urethra, it normally passes through all other parts of urethra. This is all for today. If you have any queries, you can ask. Thank you so much for listening.